can stay in their homes and not be evicted by unfair rules. And we're making sure that our public healthcare system remains strong today and for generations to come. We're building new hospitals, opening new urgent primary care centers.
This is O Canada Part 2, and oh my God, they sack all these nurses through mandates and doctors, and now they're trying desperately to incentivize and encourage people from other countries that need the nurses and doctors for themselves to go to Canada. It's a complete and utter joke. It's a debacle. And bloody turd bag, he needs to have his head read and people need to vote him out. He needs to go, Dan Andrews needs to go, Julia Ardern needs to go, and the guy in England, he needs to go too. All of those little people with small minds all need to go.
Building the first
Vote them out
new
when you get a
medical
chance.
school in
Don't
generations
support
in
them.
Western Canada,
Actually,
delivering a new compensation deal for doctors, bringing 4,600 healthcare workers back into the public sector and hiring thousands of nurses.
In the clown world in British Columbia, we are still preventing healthy, able, and capable yet vaccine-free healthcare workers from saving lives in certain medical settings such as hospitals. And beside me is Aurora. Wait till you see some clips of what happened in a meeting she went into where she asked the questions you've all been wanting the answers to Provincial Health Officer Dr. Bonnie Henry's employers.
It is commonplace for those who have received their third, fourth, fifth doses to get COVID, even if they've been vaccinated. Surely you can all see that the current strategy is not doing what it was purported to do. So here we are, more than a year later, our healthcare system on the brink of collapse, and the healthcare worker injection mandate continues to be in effect. Despite the vast amount of evidence discrediting the validity of the order, despite every other province in this country and many countries around the world acknowledging this approach is neither scientifically sound nor effective. Despite the tens of thousands of COVID-related sick calls all of our health authorities have received after the non-vaccinated healthcare workers were fired and thus not spreading COVID in the workplace. So again, perhaps someone here can enlighten me as to what is different in BC. In this email, I shared under PHSA's whistleblower policy some of the alarming red flags I noticed related to COVID while working as a nurse for PHSA. Namely, the huge discrepancy in adverse vaccine reactions occurring versus those being reported to the public. In this email, an abundance of credible resources were included. I have yet to receive a response from a single one of you. The public health measures, including but not limited to the experimental COVID injection that you have facilitated, promoted, and mandated are causing significant morbidity and mortality in this province. In Pfizer's own post-market trial data, in the first 3 months, ending February 28, 2021, their own data reported several pages of adverse reactions, including over 1,200 deaths. Myocarditis, among other cardiac issues, severe neurological issues, and a horrific rate of fetal demise in mothers who discovered they were pregnant when they received the injection.
But we need to do more. Hiring and training more nurses is part of our own ongoing work to make sure that healthcare is accessible to all British Columbians. And still, we know the demand for the skills and expertise that nurses bring to the job every day has never been more in demand in our healthcare system. There are high-skilled and experienced nurses who want to get to work in our system now, but are facing barriers preventing them from delivering the services that British Columbians need. We need to fix that. Just as we made changes for internationally trained doctors, we need to do the same for nurses. And that's why we're here today. I'm pleased to announce new supports in a faster assessment pathway that will get more nurses working in BC's healthcare system faster. For nurses returning to practice, there will be help with the costs of re-entering the workforce. These are nurses who may have taken a break for practice for any number of reasons and want to come back but are facing financial or other barriers to coming back. We want to support them in coming back to work. This includes application and assessment fee support, along with travel expenses support. Additionally, bursaries of up to $10,000 available for any additional education that those nurses need who are coming back to practice in order to be able to get to work. For internationally trained nurses, we've committed $1.3 million to set up a new pathway to streamline the licensing process. This will help our partners, the BC College of Nurses and Midwives, and the Nursing Community Assessment Service, assess more applications faster. Now, what is that going to mean in real terms for British Columbians? Well, right now, candidates in this scenario are waiting 3 years to be granted registration. Our goal is to bring it down with these reforms to between 4 to 9 months. We also want to reduce any potential financial barriers. So we had grants for internationally educated nurses, but those nurses had to pay those grants up front and then be reimbursed later. So now our government will be covering over $3,700 up front in application and assessment fees for internationally trained nurses, so that application fee does not stand in the way of them practicing in British Columbia. The bottom line is this: whether a nurse was trained in our province or not, we're ready to welcome those who are ready to care for British Columbians. Today's announcement continues our ongoing work to support more internationally educated nurses in British Columbia. Some numbers: since April 2022, a total of 5,500 nurses have said that they want to work in BC. 2,000 are in the registration and assessment process right now. More than 90% of applications were received after our government's initial actions to welcome internationally educated nurses into our healthcare system. There is still much work ahead of us, but I'm optimistic about the impact that these changes will have in a very real way for British Columbians. Now, I know that there are some who believe the way to fix our healthcare system is to abandon the principles of universal access to Medicare. They believe that the wealthiest should be able to buy their way to the front of the line, thinking that that somehow solves the line. It doesn't. It just changes who's at the front of the line. We can't cut funding and expect more doctors and nurses to show up. British Columbians couldn't afford that old approach to healthcare 5 years ago when they changed governments, and they sure can't afford it now. Everyone in BC deserves the absolute best in healthcare, no matter where you live or how much money you have in your bank account. That's my vision for British Columbia, and I know it's British Columbians' vision for how our province should work.
It makes me sick what I do for this shitty planet.